I'm Jacob Connolly. I'm a doctor and an orthopedic surgeon who specializes in sports medicine. I currently work at the Southern California Orthopaedic Institute, and next year I'll be moving to Florida to continue practice there. Um, it took quite a while to get to this position. So coming out of high school requires a 4-year collegiate degree. I got mine in biomedical engineering initially, after which requires a 4-year degree from a medical school. And then after medical school, you go into a residency training program, which is basically a beginner training program that allows doctors to specialize in certain aspects of medicine, such as orthopedic surgery, or ophthalmology, or general internal medicine, dermatology, etc. And after that, I completed a 1-year sports medicine fellowship at the Southern California Orthopaedic Institute, which is just an extra year of optional training if that's something that you choose to do. There are a lot of factors that led me to become an orthopedic surgeon. Starting out with when I was a kid, I had several sports-related injuries and had really good experiences with my surgeons that allowed me to get back on my feet, become healthy and active again. Those are things that I enjoy about my job today and that are very rewarding, giving patients an opportunity to get back to what they like to do, to be happy, healthy, pain-free. When I went to college, I didn't necessarily want to pursue medicine, primarily because I didn't want to do that much school. Overall, after high school, it's about 14 years of extra school and training. And that was a bit intimidating to me. So initially, I got my degree in biomedical engineering and worked for 2 years after college as an engineer, working on non-invasive surgical devices and instruments, which is something I enjoyed, but found myself a little jealous of the surgeons that got to use the instruments to get patients back to what they like to do. So I decided to go back to medical school and pursue orthopedic surgery. Orthopedic surgery is the practice of musculoskeletal medicine in a surgical theater. So basically, I'm a bone doctor who operates on broken bones, torn tendons, torn ligaments, and things of that nature. We do surgeries such as ACL reconstruction, rotator cuff repair femur fractures, wrist fractures, things like that. So my job's a lot of fun. I get to be active. I get to work with my hands on a daily basis. A normal day for me would be in one of two areas. I'm either in clinic. So when you go to see a doctor in a doctor's office, I see patients in the office. I get to know what's bothering them. I get to make diagnoses through x-rays, MRIs, CTs, physical exam, and then I get to make a decision on how to treat the patient. And we can do a multitude of different things, either non-surgical, just treatment in the office, or surgical treatment where we sign them up for surgery. And then the other part of my job is in surgery. So going to the operating room, making incisions, suturing, putting plates and screws in, putting rods down bones, doing arthroscopic surgery, which is with the poke holes, the camera, and the scope. So a bit more delicate surgery. And then I also would take call in the hospital. So when patients have acute injuries in car accidents or they fall down and hurt themselves, I can also treat patients in the hospital setting. The days can be pretty long. They can also be very rewarding. I think when considering a career in medicine, it's something you have to be passionate about for a few different reasons. One, it's a long process of training, and it's a lot of hard work, very long hours. Oftentimes we'll work over 80 hours a week in residency. Sometimes it's over 100 hours a week or greater. So it's important to love what you do. It's important to love your coworkers and be passionate about what you're pursuing if you choose to enter a field that requires that much training and that many hours of work. I'm not saying that to discourage anyone, because I wouldn't change what I did for the world. I love what I do. The long hours and the experience that I gained getting to this position were extremely rewarding. It's something that I can look back on and be proud of. And it's important to have that training and to put in those hours in order to give your patients good treatment and to take care of patients and to be an important part of your community and to take an active role in taking care of other people in your community. So there were trying times, certainly, both on myself and my family. But I think that both my family and myself are proud of where I was able to get to, and now I get to go out and practice and really be a doctor and really take care of people, which is what I've always wanted to do. I think the best advice I can give you in how to determine if this is something that you want to do is to get involved, is to go out in the community, contact physicians, nurses, whomever, and see if you can, what we call shadowing, is see if you can shadow them, follow them around, get some experience, intern with them to see what they actually do on a daily basis and see if that's something you're going to be interested in. And if it is, take a look at what it takes to get to the final thing that you want to do, whether that's a doctor, a PA, a nurse practitioner, nurse, whatever it might be, and decide if that's something that you want to put in the effort to do. If it is, you're going to be great at it. And if it's not, there are other areas in the medical field that you should investigate, because regardless of what you do, the medical field is a very, very rewarding one. I'm sure that the schools will have my contact information, so if you have any questions or concerns about becoming a doctor, an orthopedic surgeon, or just pursuing a career in the medical field, I'm sure they can get you in contact with me. Thanks.